Recording. Good afternoon, everyone. Welcome to this session. My name is Dana Ward. I am a training program assistant at APHRC, and I officially welcome to this session. So we have two guests who will be taking us through today's session. The first one is Ankiza Gakunu, Director of Inuka Foundation. So Inuka Foundation is a digital platform that provides anonymous and accessible mental health support at the touch of a button. The platform has provided support to 10,000 vulnerable people in Kenya, Uganda, Nigeria, and Zimbabwe. Ankiza is a psychologist and a sociologist with a Bachelor's of Arts from Notre Dame, Toronto University, and a Master's of Arts from Postpalm Business School. She has 2 decades of experience in e-health products and global healthcare. Having worked and lived in Europe, North America, and Africa, she has gained a unique perspective on consumer behavior and strategic marketing. Her passion in emotional intelligence and behavioral science led her to become a certified neurolinguist programming practitioner and a life coach. She is on a mission to make quality mental health support accessible to everyone. So I'll introduce both facilitators so that when they start, they can just go on. So our second facilitator is Charlene. She is a dynamic professional with a multifaceted career spanning various domains, dedicated to enhancing mental health, organization, and organizational excellence. As a counseling psychologist, she brings wealth expertise in understanding human behavior and well-being, integrating therapeutic principle and providing compassionate guidance to individuals seeking support. Having over a decade of experience in business, tech, and well-being, she thrives in fostering innovation, streamlining workflows, strategic management, and operational efficiency, spearheading initiatives in destigmatize mental illness, promote growth and well-being in diverse communities. With a blend of psychological expertise, technological survey, and business acumen, she strives to ensure that individuals receive personalized and effective care in an increasing digital world with a social impact goal to make a meaningful difference in the lives of others. So just a few house rules. If at all, maybe you want to ask a question, you can put it on the Q&A section in the platform. We'll be able to answer them. And you can also put your comments on the chat. We'll be able to take them as we proceed. So feel welcome, and I leave this to Charlene to take it over. Back to you, Charlene.
Thank you, Diana, for that very nice introduction. We're really excited to be here with you all. We're hoping to make today's session very interactive and very informative. I see we have over 52 participants with us. I would love to hear in the chat what country you're all from and where you're coming from, so that way we also get to know each other as we go along. So welcome. We are here today to talk about mental health interventions. And thank you to the African Population and Health Research Center for making this possible. We're going to really look at what it takes to create and launch a mental health intervention, specifically a digital platform. You will see that we will have a lot of chance for Q&A. We will be asking you your own inputs, your own lived experience. But ultimately, we are Inuka Africa. And for us, our vision ultimately is to have an Africa where everyone has access to quality mental health support. So we believe in the motto, together, everyone resilient. So let us move on to the next slide and get to see and understand a bit about who we are. So we're a social enterprise, and we're really on a mission to make sure that people have the right skills to equip themselves in order to tackle whatever personal and professional challenges they may be faced with. We will go into more detail a bit about our co-founder also, Professor Dixon Chibanda, who is also director of the Friendship Bench, that are leaders when it comes to pioneering peer-to-peer mental health support that has been proven effective in reducing anxiety and depression symptoms. Next slide, please. So overall, we have helped really thousands of people across Africa. And the great thing with the work we do is we have helped everyone from CFOs, CEOs, all the way to youth in slums, healthcare workers. And along the way, we have partnered with several policymakers, mental health advocates, companies, individuals, and people from all walks of life. So we've really been able to gather data, to gather insights, and improve upon our innovation. So today, what will we be covering in this webinar? We're going to start off by really identifying the need. I know we've all heard of mental health, but what is really mental health? What is the need, and how are we defining this problem? Number two is looking at the multidisciplinary approach to innovation, the different fields, the different approaches we had to use in order to come up with this intervention. Then we'll take a deeper dive into the coaching method. We're saying we're a mental health intervention that uses coaching, but what coaching method are we using? Then we look at data that we've gathered, how we evaluated it and report on it. We will look also at our work and our impact, which is why we do what we do. And hopefully then we can share with you key insights and takeaways from this session. And of course, we will have Q&A and some discussions after. So we really want to have a section here of get to know us so we can also get to know you. I like to say that I'm Chief Vision and Facilitation Officer because ultimately my role is to bring this vision of quality mental health care across Africa to life and to facilitate it however best I can. I think we always start from our own lived experience and why mental health. And it's always good to identify what inspired me. I think in my case, having been raised for most of my life, actually, in Europe and abroad, I faced very many challenges. And it really led me to question, people's behavior. Why do people do what they do? How are we different? How come some of us are resilient and strong and can handle adversity and all that life throws at us, whereas some of us really fall under and maybe even lose the fight. So this really prompted me to want to understand behavioral sciences, number one. And that led me on my own journey to become a psychologist, sociologist, and life coach, and really start working in a space where we were using technology for good. And ultimately, my dream is by having more resilient mothers or fathers or partners or colleagues or peers, is that we're able to build a better future for children in Africa, because we know that when we are healthier, when we are mentally fitter and resilient, we do produce a next generation that also is more resilient. So I'll hand over to Charlene to also introduce herself briefly and then continue on.
Great. Thank you so much, Ankiza. Good afternoon, everyone. My name is Charlene. As far as introductions go, I think for Inuka Africa, I am Chief of Getting Things Done. So I'm sure each and every one of you has someone in the organization who really spearheads a lot of the implementation of things and also training. I'm a licensed counseling psychologist. I have a background in tech and business. And one of my key positive impact in the lives of as many people as I possibly can. And of course, so far, I've been able to moderate such conversations, over 400 such conversations around psychosocial wellness and mental well-being. I've given over 1,500 hours of therapy and, of course, led impact projects across Africa all around mental health. I look forward to today's conversation and continuing this conversation around Inuka Africa with you today. But for now, let me hand this back to Ankiza.
So I think you've gotten to know us a bit. Now we'd love to get to know you. Specifically, we have a set of questions here that you'll see on the next slide that Charlene will ask and moderate here. A bit about, checking in and learning a bit more about each other.
Great. So, of course, it is customary that when you walk into any place on the planet that you have to start in with a check-in. Because if you walk in and you fail to say a good morning, a good afternoon, a how are you, a lot of the time you will be perceived as somebody who's quite unfriendly. And that's not our goal today. So how about we start with our first check-in? Because of the number, we may not be able to unmute ourselves to respond. However, please feel free to go to the chat or to the Q&A section for your responses. We'd really love to check in with you. And our first question of today is, if you were to use an animal to describe how you're feeling today, which animal would you pick and why? If you were to use an animal, if you were to pick an animal to describe how you're feeling today, which animal would you pick and why? Right? And maybe Ankiza, as our audience is typing, we could start off with you. What's your animal of the day and why?
I definitely have to say a bee. I feel that I have been buzzing around, very busy, and really trying not to sting myself or anyone else.
Great, thank you so much. I can also see our first participant have said that they feel like a cat today. My question would be why? Why a cat today? Somebody else feels like a sloth. So please bear with me. If you see me looking to my side, I'm just referencing to be able to read all of your comments as we go on with the segment. Someone else feels like a sloth because they're feeling a bit slow and a bit lazy today. Someone else feels like a rabbit and they're feeling gentle. Thank you for sharing that. We also have a lion in the house, which is pretty amazing. Thank you. So far we've got bees, we've got cats, we've got lions, we've got rabbits. We also have a bee. Someone else says that they're feeling like a bee today because they're super busy. At the same time, they're also moving around. Someone else feels like a lioness today. All about gender. Thank you. And we also have a tiger and a bee. Amazing. Thank you so much for participating in our first round of Get to Know You. It's pretty amazing to see which animals we describe because a lot of the time you'll find when somebody asks you, hi, how are you? Our first or almost instinctual answer is to just go and say, I'm fine, thank you. The world could be burning around you, but you're not going to go out and say, okay, I think I'm feeling overwhelmed today. So sometimes when we get a bit more creative with our check-ins and we get to really understand how a person is feeling outside of our social conditioning to respond with a positive, I'm okay, thank you, I'm doing well, thank you, everything is going well, thank you. So great. Thank you all for sharing. I can see we also have a gazelle that's come through. Our next question is, if you were to use a quote, or what's your favorite quote in life rather? What do you find yourself constantly repeating to yourself? Something like, oh, I can do hard things. That's a life quote. So what quotes do you find yourself constantly repeating? Right. And maybe Joel or Diana, I can start with you on this one because I think you're able to unmute your microphones as our audience type out. What's your favorite life quote, or what quote do you find yourself constantly repeating?
This is Diana. When in a tricky situation, I normally tell myself, this too shall pass, or
This too shall pass.
Yeah.
Great, thank you. That's a really good quote. It's a very motivational one, right? This too shall pass. Joel, I don't know if you have one before we go into the comments that are coming through.
No.
You don't have a quote. So when
Yeah.
you get off, you're just like, okay, we're just here. It's okay. All right. So back to the comments. Thank you, Joel. We have someone who says that their favorite quote is "I can thrive." That's great. Thank you for sharing that. Someone else says, sorry, just give me a minute as I'm reading through this. It is a bad moment, not a bad day, and not a bad life. That's amazing. It's a bad moment, not a bad day, not a bad life. All dreams come true, each and every one. That's very positive. Thank you for sharing that. Someone else says, trust the process. Someone says, I know the plans I have for you, the plans for a hope and a future to prosper. Great. Thank you so much for sharing that. Whatever you do, do it with might. Thank you. It's so amazing to get to read all of these quotes, and I hope you're picking up on some of the quotes as we go along. So we become who we think about. Thank you for that. That's actually true indeed. We are who we think we are. Keep on keeping on. Live and let live. All of these amazing quotes. I may not be able to read all of them because we are 80 people on the panel, 90 people on the panel, and I may not be able to read all of these, but I believe all of you are able to see the chat section and you can see the comments that are coming through. So thank you so much for being so interactive. Why do we ask a question like this? What's your favorite quote? Because a lot of the time, these are our motivational statements. Remember, we're talking about mental health. We're talking about digitizing mental health. We're talking about creativity, right? So even when it comes to what would seem like the simplest of tasks, right now you'll find that you've gotten to know so much about each other simply by which animal you chose to represent you today and which quote you tend to repeat every single time you need to get through something. Why? Because these are the quotes that keep us going. And as we close off our second Let's Get to Know You today, let's move on into expectations. Because what brings you here today? Why did you choose to join today's conversation? So my question is, what are some of the expectations you have of us today? What do you expect to learn from us today? It would be really great to get to know some of your expectations so that we can see if we're able to meet them, if maybe we can answer some questions as we go along with today's webinar. So what are some of your expectations of today's conversation? What do you expect to learn from us? All right. So I know, again, we're talking about digital platforms. This is one of the things that happen, that sometimes we may have a bit of an awkward silence as we wait for people to text. But as we go on, so somebody says that they would like to know more about digital innovative interventions for mental health. Thank you for that. Someone else says about digital health. Scaling mental health interventions through digital platforms. What doesn't work? Very, very important point. That's true. What doesn't work? Understand digital health and how to best make use of it. All right. Starting a mental health nonprofit. Thank you for sharing that. Get to know more about digital health. Get to know about how data has been informing our decisions, or our decisions as Inuka. Digital interventions to save children and maternal mental health. Learn about contextual interventions relevant in Africa. How to transform mental health experiences. And of course, examples of practical digital intervention models and real-time examples of desired mental health outcomes. And of course, a case example. And then get to know how to incorporate digital mental health into my organization. Perfect. Thank you all so much for being so interactive and sharing your expectations with us. We will aim to be able to answer all of your questions and, of course, meet your curiosity points. But for here, let me pass this back to Ankiza so that we can continue on with our segment.
Great. So excited and really interesting to hear everybody's feedback there. So now we move into really section 1, identifying the need and defining the problem. This is really critical, right, in the stage that we are. So please, next slide, Charlene. So we really need to look at it from the macro level in order to even begin with our intervention story. And by the numbers, we know with data provided by WHO that 1 in 5 Africans today are living with a mental health condition, yet 80% do not receive care. The 3 main reasons for this are the high cost of care, the lack of mental health professionals, and the high levels of stigma that we face. And in the case of Kenya, we actually have less than 1 per 100,000 mental health professionals available. So already that sets the stage for the demand versus the actual meeting the needs of this demand. And ultimately, these are real lives impacted. These are not just statistics. And what does this mean, for everyday person? This is really the mother who is unable to cope with parenting stress, who feels chronic anxiety, or the HIV/AIDS patient who does not take care of themselves and has been perhaps diagnosed with clinical depression. Or it might be the case for most of us, even on the continent, where we find that we are not able to find employment. We are not able to provide for our family. And this is causing a huge mental strain on us and also our dependents, right? Next slide. So we look at that from the macro level, and we have also other details that come up very strongly. Charlene, please, next slide. So one of the key challenges that we have is we are dealing with a lot of the time the worst case scenario of anxiety, depression symptoms, which ultimately leads to suicide outcomes. And I know I was completely surprised when Kenya was ranked 4th most depressed country in Africa and 9th globally. Even Kenya's suicide rates today exceed rates in developing countries, some of them like India and Mexico. And we don't take the time to realize, what devastation this causes on the community level, on the societal level, and on a nation level. And, when we look at it globally, 700,000 people per year die by suicide. And just to bring that home, most of us record a voice note on WhatsApp that is about 40 seconds long. And that is the average voice message. And in that time alone, 1 person has lost their life to suicide. So this really drives home the point. And when we look at the African continent, these rates are really accelerating, unfortunately. So when we look at even the SDG goals, the UN, Sustainable Development Goals, one of the key goals there when we look at SDG goal number 3, which is all about well-being, is how do we create innovations that ultimately will help us in reducing suicide overall. So let's chat. I want to hear a bit more about your feedback in the comments. And what do you think are some of the mental health drivers in Africa today? When we hear these figures, they're very alarming. But what, in your opinion, are some of these mental health drivers? So we can share a bit on the chat. We have here poverty, very, very, very big issue to tackle. Relationships, poverty comes up a lot. So lack of resource in most African countries, employment, unemployment, culture. How do our culture and our customs contribute to that? Political instability. We're looking also at social expectations and norms, all very key points. Trauma, keep those coming. And indeed, if we look at, what we have found, next slide, is we have seen that all these areas are extremely important that you've mentioned here. Some of us may be, see money, fear, the uncertainty, financial, even post-COVID, and COVID's implications it had on our mental and emotional and even financial health, right? Looking at government, retirement, different areas of life, definitely. And what we've done is, in many of our own research, by actually going out there and providing mental health support to people, we've come up with data. And a lot of our data shows that key is socioeconomic factors, right? A lot of these are external factors, which are important to note. So relationship stresses and worries, but also things like struggle with identity. I mean, in a global world now, what are the conversations we're having as Africans, as what is an identity that helps us not only perhaps preserve some of our own culture and heritage that we're proud of, but also incorporate some of the more modern or global ideas of identity. So that's also a big one coming out. And of course, health. I saw a person in the chat wrote chronic health conditions. Of course, we know we have several chronic diseases that we are still working to combat. And of course, work and fear of the future. A lot of fear of what is to come when we are dealing with sometimes political or economic uncertainty. So next one, climate change also, thank you for sharing that. That is also an emerging theme. So when we look at all these challenges that are really causing our mental health to be challenged, what are some of the barriers, do you think, preventing people, even yourself perhaps, or a friend or a family member or a colleague, from accessing mental health? What are some of the key barriers you think that are preventing people from accessing it? And ultimately, which is a sort of build up to the first question, is what cost do you see this is having? Whether it is in your social circles, in your community, what is the cost we're seeing by the fact that people are not able to access mental health? Great. So we see here lack of information, stigma, very big in our society, discrimination, culture, and a lack of known social support systems. So maybe there, right, a big one is failing social support systems, limited facilities, which could be economic or funds to access a therapist, the high costs of care there. Cost, somebody says, of accessing mental health services. A therapy session costs on average 2,000 Kenya shillings, which not everyone is able to afford. For those of us, I think with the dollar, that's somewhere between $10 or a bit less, but still very expensive for the average person. Lack of economic productivity, etc. So these are all key points, and please keep sharing them in the chat. And indeed, you are very right. And when we conducted our research, we found there were three main barriers. Really three key main barriers here. Why are people overwhelmed and not finding or getting mental health support? And you're very right. Number one is stigma. We still have a lot to do around psychosocial education. I think if you recall in the beginning, we had to even define what is mental health and what does that look like and what does that mean? Because if I say I'm struggling, and I turn to my parent or I turn to my friend or peers at work, will they associate me with having a weakness of character? That I should be able to deal with life and handle multiple roles I juggle as a mother or a wife or in my case a CEO, and will I have shame around that? Then we also deal with fear of confidentiality. A lot of the time, people that we tend to trust unknowingly so perhaps go on and share information. We don't yet have a lot in traditional, sometimes therapies around protection, and here, data protection, etc. But what we did come to find is that when you do have psychosocial education and you train certain groups, a lot of the time we all still benefit from having group support, right? So peer-to-peer support is very important. And I think somebody also said access, yeah, was a big one. How is it affordable? If it's costing us 2,000 Kenya shillings, and that's probably on the low side, anywhere even up to 10,000, etc. If we're looking at psychiatric help, reliable and quick, what do we do? And a lot of the time, mobile phone penetration, as we know, is widespread. In the case of Kenya, over 90% mobile penetration. So how do we leverage technology, which is here to stay and growing very fast in Africa, to make sure that our innovations have also a mobile first approach? So here we are, and all in all, I like to say mental health is costing us so much more than just our happiness. Oftentimes we talk mental well-being, and the number one question is, are you happy? This is not about happiness. This is about basic structures in society that allow us to thrive, not only as individuals, but as communities and as a nation. And we have here some key statistics that show, whether you're working with cases of burnout on the rise, with high job turnover, with high stress and chronic anxiety now, what are we doing about it? And also the implications, of course, of ill mental health when it comes to now physical ailments and physical dis-ease. How do we work with those things? Because oftentimes what we fail to realize, especially even as companies, is over 40% of people who go to clinics or to doctors have an underlying mental health component. So the main causes to a headache, to a stomachache, to chronic backache is actually mental health related. So next slide here. So the need, right? What is the need? And I think we've clearly identified the problem here. There is a problem. And there is a worldwide need, not only to support people who are living with mental health, but actually to prevent. We have all heard that it costs less to prevent than it is to actually treat the disease. And we need to meet people before they spiral down and hit a wall. And there's been a lot of talk over the years, probably even over the decade, on task shifting. We have famous researchers like Vikram Patel who have written about the importance of task shifting. The concept that we can take key but simple tasks from professionals like doctors, psychiatrists, and psychologists, and really teach them to people in the community. We're all familiar now with the success of community health workers and community health promoters. The idea that we needed to devolve healthcare tasks to laymen and women who are able to do it in order to address, obviously, our healthcare systems. And so this is really no different in this methodology. And again, we went on this approach or concept of task shifting when we looked at how can we take these key tools and really empower people to have a sort of self-help approach to mental health. And that is where, we believe that scalability, effectiveness, and affordability can be achieved. So really our goal was to take this and make it a large-scale implementation. Next slide. Okay, so I think we will ask a question here just to have a moment of reflection, and also I will check the chat. I will also bring in Charlene here. Because ultimately, maybe I'll ask the question, then we can read some of the comments, but would you say, there is a mental health need, and even I would say crisis in your country? And if so, what is the need? So maybe as you answer that question, and I saw earlier on, we had participants from Zimbabwe, from Pretoria, South Africa, from Ethiopia, and I'm sure there's several other countries that you're all from now that we're over 100 people here. What are basically the mental health needs that you have identified in your country? Maybe just observing it even in the last few years or even post-COVID. Charlene, we can also go to the next slide as we read comments.
Yes, of course. As we wait for your responses, maybe I can just flag the admin. There's some administrative questions that are coming through the chat. Maybe you could be able to respond on our behalf. So we have our first response coming through. Someone says, yes, there is need for easy and confidential access to mental health care services. Thank you for that. What would you say are the mental health needs of your country right now? Someone else says, not really. There is need for easy accessibility and affordability. Someone says, making mental health demand as a norm is a need that we need to meet, or they need to meet in their country. Great. And as these responses keep coming through, thank you so much for being such a lively audience and participating with all our polls. We can now move on to the next segment, and Ankiza, I can give this back to you. We also have sensitizations and trainings coming through as needs in different countries.
So now we kind of start section 2 here, which is the multidisciplinary approach to innovation. Innovation requires a lot of different skill sets, a lot of different minds, and a lot of different insights and data. So we had to look at a multidisciplinary approach. And when we look at that, it's really a wheel. Next slide. We look at psychiatry, we look at the fields of psychology, we look at technology and software development. We are talking digital platforms here. We look at data science and analytics, the importance of lived experience, number one, and having people with lived experiences who are able to help us in our user experience design ultimately. Quality control and data protection being top of mind when we're dealing with such sensitive cases. Marketing and outreach, and last but not least, of course, sensitization, existing research. So we took into consideration all of this. And this is where we went to a radical task shifting approach to support people called Friendship Bench. And this is where Dixon Chibanda comes in, who is our co-founder. So Inuka co-founder Dixon really uses, again, his own lived experience. He was a psychiatrist in Zimbabwe who ultimately was trying to help people who were living with mental health. And he was seeing a client or a patient. And one day he got the unfortunate call that she had taken her life. And when he managed to reach out to her mother and find out, what happened, we had just started a few sessions, we had come up with a treatment plan, what went wrong? Her mother said, we weren't able to afford fare. We weren't able to afford transport to come to these sessions. And obviously that was devastating, right? Because any life lost is hugely devastating. And all too often, this kept happening. And so he realized that we had to do better. We could not be having roadblocks or barriers such as cost of transport as a reason why someone could not access this. And so he had to think of a radical approach. And this radical approach involved looking at, the community's best and wisest resource, which is ultimately grandmothers. And he looked at these grandmothers who, again, were very knowledgeable, very close to certain community members. And he decided to train them in what we now know as problem-solving therapy. the idea that, I can listen, I can show empathy, we can help identify problems together and help you come up with solutions. And so this was really research he was able to publish through, again, randomized clinical trials with several different community members. And ultimately, this led to validating the fact that it was effective in reducing anxiety and depression symptoms, and was published in 2017 in the Journal of American Medical Association. And again, it kind of took an organic approach. It was a bench. People would sit, as you can see in this picture, and come and talk to the grandmother at the time, or whoever was on the bench. And so now when we look at Friendship Bench, which is a globally known NGO, it's important to remember sort of the origin story and the fact that through this the trainer's approach, he was able now to scale it to where 10,000 people per month, are receiving treatment. And now Friendship Bench is first line of mental health care in Zimbabwe. And of course, has gone on since to be published and viewed all over the world. There is a TED Talk also there that you can watch for yourselves on Google, really, about this story. But so we didn't start out of nowhere, right? We were able to look at this scientifically backed coaching, problem-solving therapy approach and say, well, this already works, right? It's already been proven effective in reducing anxiety and depression. How can we maybe support in scaling this further, right? Not everybody, especially now, as we know, in urbanization and changing community structures, has access to a grandmother or a bench. So we took research, which is the next slide. And I also invite you all to look and read through this research. We will not go into a lot of detail now because of time purposes, but really interesting to look at how this has been used in different contexts. And what we were able to do is in 2019, we began a pilot study where we looked at community health workers in Kenya. We equipped them with a tablet, and we worked with them and their fellow community members to see how effective the digital version of this would be. And from this, you can see the second research paper here. We were able to have a community health volunteer delivered problem-solving therapy through mobile application based on the Friendship Bench. And this study was published in Cambridge University Press in 2021. And again, we are still trying to build upon our research to really validate much more that mobile interventions are also effective in reduction of anxiety and depression symptoms. And don't forget, we're trying to really validate this within the African context. So we are currently working on several projects in South Africa, even in Palestine right now, occupied territories of Palestine, to validate that through mobile, whether it is a humanitarian crisis, whether it is a health crisis, we are able still to deliver much needed quality mental health support through mobile. Next slide. So when we look at the theory behind Inuka and how it came to be, using the psychiatric experience and psychological fields, looking at the research field when it comes to data validation through RCTs and other pilot studies, and then, taking the primary method of Friendship Bench, and then combining that with our focus, which was really the technological part of how do we create an online platform that primarily allows people to screen for mental health symptoms and then connect them with community heroes or coaches, however we call them, at scale, And then also from the coach point of view, because these coaches are laymen and women, right? We also need to have a layer of supervision where we are able to supervise these coaches at scale, make sure that we have standardized quality control, and again, across the board, and then also make sure that coaches are using and following through, being fidel to the actual method. And so by combining that, we were able to come up with a prototype of a scalable and affordable mental health support system that we really wanted to make sure was accessible anywhere and at any time. And so what we started with, if you like, was the digitized version of the Friendship Bench. Great, next slide. I will hand over to Charlene as we maybe look at some of the comments here for just a bit more of an interactive session.
Great. Thank you, Ankiza. I hope we're all following along so far. We have been able to introduce you to who we are as Inuka, where we came from, why we are who we are. And as we continue on, we'd just like to take a break here for a minute. More so a water break. We've been talking for about 45 minutes right now. And this is just kind of note to self. We'd like you to actually think about some of the mental health stories that are originating from your country. When we were talking about Professor Dixon Shibanda and what actually pushed him to innovate the Friendship Bench, or how the Friendship Bench came to be, we were talking about somebody who committed suicide because they lacked bus fare. They did not have enough to be able to commute from one point of the country to another just to be able to access the healthcare that they needed. And because of it, somebody lost their life. So when you think about your countries right now, and we're talking about mental health and optimizing digital platforms to be able to assist with the mental health pandemic that we currently have in Africa, what are some of those stories that you hear? And what are they looking like? And I can see some of you have already started sharing on the chat. So thank you so much. Let me start by reading some of these. Somebody says, died by suicide rather than committed suicide. Thank you for that grammatical correction. It is true that a lot of the time we tend to use statements that can be quite branding and quite disruptive for a lot of people. And as we go through the Inuka method, we will be able to talk about the role of empathy, active listening, and empathetic listening also as part of the Inuka method. So someone else says partners killing each other due to wrangles in their relationship and gender-based violence. That is true. It is all over at this particular point in time. It's more person-centered language. Thank you for that. A man committed suicide because the wife threatened to divorce him. At the end of the day, these are some of the challenges we're talking about. How do you deal with stressful situations? And what impact, when we were talking about the mental health drivers, what impact is it having and at what cost to our communities? So we have femicide that is also being mentioned here. Thank you so much for sharing and participating in this poll. So as we go along with today's segment, this is a question that we'd like you to have top of mind, because at the end of the day, these are some of the needs that need to be addressed when we're talking about mental health across Africa. And Ankiza, I can pass this over to you.
Great. And thank you for sharing. Please do. I think we want to use it as a learning opportunity. And I'm reading some very interesting feedback from many of you. And really food for thought, right? And let's use this as an interactive session where we also have our notepads and write down things that really could help us in our innovative processes. So everyone has a unique story. I think I talked about the multidisciplinary approach, right? The idea that we looked at existing data, we looked at the fields of psychiatry, of psychology, and then we go to really the client-centered approach. I'm sure we're all very familiar with design thinking, the idea that we must innovate around the people or the person that we seek to provide the solution for. And so we worked also, we are not data scientists or researchers ourselves, but we worked with data scientists and researchers in different areas to really come up with what are these stories? What are these experiences? We know the needs, we understand the problem. And at the end of the day, people have unique stories, Some of us are wanting more out of our relationship, or maybe better relationships. Some of us want to figure out, how can we motivate ourselves? How can we find passion and interest in what we're doing? We have the healthcare workers right now that, we all can understand that there is a lot of work pressure. How are we helping and supporting them? And again, it could just be a struggling mom or dad working from home or juggling different things, right? And we all have our stories, and all our stories are very valid. So what we did when we worked with data scientists in the areas of qualitative or quantitative research is we had to sit down with really a number of people. In our case, we're based in Nairobi, Kenya. So of course, we sat down with most of the participants here. And we just wanted to understand more about their pain points, about their barriers, and how ultimately the innovation could reach them and transform their lives in order for them to live happier and healthier lives. So we aggregated this data and we put them in different buckets, and we came up with different personas, and we looked and studied those in details. And obviously we were looking at patterns, we were looking at, key demographics here and psychographics. And so we came up with these personas, and I'll just share one or two. Again, these are not real people, but it's like developing a product, right? If I'm developing a product, I need to understand who is it for, right? Is it for the mother? Is it for the worker? Is it for the farmer? Who is it for? So these are personas. They're not real people. They're not real faces. They're not real ages. They're not real names. But in core development, in user design, you have to say, this is Mary. She is 35. She's dealing with substance abuse. She has 3 kids, etc. You need to understand in detail who Mary is in order to be able to, develop the right marketing and outreach approaches, the right communication. And then ultimately, even with tech, understand, is she tech savvy? Is she, tech resistant? Level of education, etc. So it's important to note that these are personas. We made them up. They're not real people. If anybody's name is here, this is per coincidence, but these are stories. So just to give you an overview of really how detailed we went in building these personas, we came up, this is Judy. She's 21, she's in her final year of college. She's living with a roommate, and she has had very stormy relationships with her boyfriend. Some would even say really gender-based violence here, a lot of confrontation. And so she's overwhelmed by hard decisions that she's got to make. And when we dig deeper, we find that Judy is actually dealing with a fallout with her boyfriend from an abortion that she did not have, that he wanted her to have. And she's found it very difficult to move on, and again raise now a child as a single mother. And what she's been dealing with really is a lot of anger, a lot of resentment, and that's coming out in symptoms such as anxiety and self-blame and emotional despair. And when we look at someone like Judy, where does she go for help? We found that it could be online, friends, support groups, and student counselors. But again, there was a lot of blocks there of why Judy wasn't going. And again, when we, asked further questions, we found that perhaps, there was, again, judgment is very big, financial limitations for some of the paid counselors, and too many questions. Sometimes it can be overwhelming when we use terms, especially in Africa, therapy and counseling, like the idea of sitting down and talking again and reliving the problem to someone can be very overwhelming. So where do we reach someone like Judy? Well, there's, of course, social media, which is key. There are notice boards at her college, support groups, and just basic awareness through campus. So this is an example of Judy. We go next to the next Inuka persona that we created. And in this case, we have Eric. He's 35. He works as an accountant at a law firm. And he lives alone, recently divorced with 2 kids. And it's been really hard on him, right? The emotional, financial burden of divorce, the idea of kind of losing his whole family, and then dealing also with job insecurity. The law firm hasn't been doing well, clearly struggling. And he's really in a tight spot when it comes to money. And so he got, hooked on gambling, really hoping for a windfall, hoping that he would get money very fast to kind of pay off the mounting debts, but then found himself in a downward spiral, gambling his life away. What was he looking for really, or what's he looking for right now is he's looking for understanding. He's had a really hard blow and really lost a lot of confidence. And now with the gambling addiction, which seems like a bottomless pit, he can't pull himself out. And yes, he has his brother and online, but again, his brother has his own life and his own story. So it's manifesting how, in what symptoms, right? Of course, there's loneliness. There is, unable to make sound decisions, low self-esteem, and chronic anxiety, right? People are asking for their money and not sleeping because of that. So again, what is a block here? Having worked with a lot of men, we realize that communication, talk therapy, etc., is really overwhelming for most. And also, he feels that his problems are too complex, right? Like, who can help him? And where do you reach such a person? In betting offices, maybe online betting sites, through church groups, etc., if at all. So this is Eric. And of course, there are several different Inuka personas we developed. But why was it important, for us to develop these personas? Because it was important because it helped us now look at messaging and understanding how best do we communicate to get these people to come in, basically come through the front door. When you have a prototype, you obviously need people to interact with it. And so you need to understand who these people are and what they're looking for, at least at a basic level, in order for them to even want to come in through the front door. Next slide. So our goal is very simple, and you'll notice we use these things called blobs. So this is one of our mascots, or brand, if you like, is the blobs. And these blobs really tell very simple stories because we believe simplicity is key. And we have this blob on the left that shows confusion and shows lack of clear decision making, and just the inability to solve or to walk yourself through all these thoughts and issues. And what Inuka does, and this is our coach, our certified coach on the right side, is we help you one by one really identify in all of these problems what are really key. Sometimes we feel we have so many problems, but we fail with the support sometimes to see, oh, maybe this is the key problem that I need to work on. It could simply be self-worth or self-esteem or, you know, better relationship with self and therefore others, whatever it may be. But we help you then go through these problems to really identify what is the difference that will make the difference. You know, there's that key one that will definitely make a difference. Next slide. So, you know, the Inuka personas, you know, are not limited, of course. There's very diverse, and we have gone on to innovate and serve very many different groups across different countries in Africa in different contexts. But this is just an overview, you know. Who else do you think could use mental well-being or wellness digital platforms? When you're looking at your innovations and what you're hoping to accomplish, you know, perhaps there are very niche markets, perhaps there's very mass markets, but really, who else do you think, and who might be underserved? You know, even though we might argue and say, you know, everybody is underserved in the African context, but who is really underserved? And so these are just some of the bullet points that show different thematic issues, as well as different you know, psychographic issues. And ultimately, one of the things that we were very keen to do is innovate, of course, for the youth. You know, the average age in Kenya today is 20 years old. It's important that we innovate and take into consideration that a high number of youth are using this, and what are their needs, right? So again, we can look at substance, etc. The key thing for us in using our coaching methodology was it works in various contexts. And we're still doing research to validate that it can work whether you are dealing with postpartum depression, after having a baby, whether you are dealing with grief, whether you are dealing with substance abuse, sexual addiction, trauma, whatever the case may be, this simple method can be used. Thank you. Next slide. So before we go into the next section, which will be looking at one of our other multidisciplinary approaches that will be coaching and moderated by Charlene, I wanted to have a wellness quick fire round. We are here to talk about mental wellness. And so therefore, we also want to use it as an opportunity to educate ourselves and to share as a group. So in the last week, I want to ask you all, how have you prioritized self-care? How have you done something, or what have you done rather for yourself to prioritize self-care? So please use the chat. Welcome to all new participants who are here. We're glad to have you on board. We're having a wellness quickfire, and then we'll pause for a short break. And please do share how you prioritize your self-care. And maybe I'll hand over to Joelle. Joelle, I'm going to put you on the spot and ask, since you told Charlene you didn't have a quote, is how do you prioritize self-care, if at all? I'm hoping you do. And what do you do for self-care? Can you unmute yourself, Joelle? Or, yeah.
Oh, yes. Okay, yeah, you got me on the spot. So so how do I prioritize self-care? Oh, okay. Let me think on that.
Okay, maybe I can go to Sylvia. Sylvia, are you with us? Okay, Sylvia not with us, but let me read the chats then, as she maybe unmutes herself. So here I have, someone says, I make sure I prioritize my work so that I utilize my day effectively and sleep well at night. I really like that one. Yeah, really good time management skills there you must have. Someone says blocking off time in my calendar and exercising. I love the one of exercising. It's such a good way to really unwind. Availability of extra time. Somebody says, I take 2 to 3 days leave just to relax and unwind whenever I feel fatigued. I love that. That really speaks to very clear boundaries. Somebody says, I worry less about things beyond my control. Fantastic. And this is actually one of the key things with our coaching method is, your circle of influence and your circle of control, right? What really can you control or not? So somebody says here, last week I was doing a very important interview. It was a really big deal and I couldn't sleep. What I did was batch cook on Sunday and rested till Tuesday when the interview was scheduled. I also had comfort food and talked to friends to feel more loved and have a sense of community. Fantastic. Really important actually too. And I see a lot of themes here is planning, right? Do we pick that up in the chat? How people are really having great planning to make sure that when they know to expect a stressful period, they plan rest or they do other things to make sure that they're prepared to have downtime after a busy time. Somebody said, take regular breaks and weekends. I really love that because it speaks to, again, the importance of just basic care, right? We sometimes don't look at, are we eating? Are we sleeping? Are we connecting? These are key things that in today's world, we've even forgotten the power of just connecting. And I don't mean social media scrolling or doom scrolling. We mean actually reaching out to a friend, a loved one, doing something physical, going for a walk. Somebody says here, I see, aerobics after work, and on Friday, took a long walk, 10 kilometers. So this is really important stuff here. So thank you all. Keep those coming. I hope for those of us who don't have ideas on self-care, we can take note of what is being shared here in the chat. Again, it doesn't have to be anything important or anything big. It's really about really the basics of care for self. Thank you. Charlene?
Great. I hope we are all still together. At this particular point, let's take a 5-minute break. It is 10 minutes past the hour, so please let's be back at exactly 15 minutes past the hour so that we can continue on.
Hi, everyone. So we're about to start back shortly. So please come back to your screens if you've stepped away. I am happy to see, Joelle, you've shared with us your self-care. It's really important that we do prioritize self-care. So I'll hand over to Charlene, who'll take us through the next segment.
Great. So good afternoon, everyone, once again. Again, thank you for being with us all through. I know this is a 3-hour segment. So your interaction, your patience is highly appreciated. And we hope that we are answering some of the questions in relation to the expectations that you had set. As we go into our methodology and, of course, the development of our tech, so that we can kind of just give a brief overview as to how Inuka actually works and how we're able to reach the communities that we're able to reach them. In case you have any questions as we go through the segment, please feel free to start posting them on the Q&A section as early as now, so that by the time we are completing the segment or we're completing the webinar, we will have collated or we will have at least enough questions to be able to answer all of your questions. Yeah. So before we dive in to Inuka as a method, we were reading through some of the comments and we realized there's some people who are saying that they rarely do self-care, that, you know, self-care is actually not a priority. So this is actually something that we wanted to address before we continued on, primarily because self-care is unique to every individual. So as you look at some of the comments that were coming in through the chat section, you'll find that different people do different things, from devotion to pets to scheduling time to take breaks. However, self-care is not something that a lot of us acknowledge or identify. Why? Because when we give ourselves the bare minimum, we think that we're looking after ourselves. Because we fed ourselves, because we got out of bed, because we were able to put on clothes in the morning, a lot of the time we'll tend to confuse that with self-care. It is indeed self-care, but it is basic level self-care. The reason we emphasize on self-care, the reason it's important to take a break to focus on yourself, is primarily because when we're stressed out, and life can be very stressful, a lot of things, we talked about the drivers, we talked about poverty, we talked about relationships, we talked about work-related stresses, we talked about community and family-related stresses. Any single time we are stressed out, for the doctors who are here today, our PhDs, our data scientists, all of you who are here today, then we know that when we're stressed out, we release things that are called stress hormones. We release adrenaline, we release cortisol. Overproduction of these hormones tend to slow down our systems. They tend to make us feel quite lethargic. So when our key focus is around depression and anxiety, remember, you didn't just wake up one morning. Somebody didn't just wake up one morning and find themselves in a depressive state. It started from stress. That the difference between the person who got out of bed in the morning and was able to be functional and was able to be productive, and the person who was unable to get out of bed in the morning, was actually a coping mechanism related to self-care. So when we look after ourselves, when we spend time to take a break, when we take a moment to have conversation with our friends, when we turn towards our pets, when we look for different ways that we tend to enjoy ourselves, then we also tend to release what we call the happy hormones. So we're talking about oxytocin, norepinephrine, and all those hormones that are responsible for making us feel energetic, for making us feel motivated, so that we actually have the energy to face every new day. So in conclusion, as we finish off with our self-care or our quick fire check-in, those are some of the reasons why it's important to look for everyday routines to be able to look after yourself, to keep yourself going, so that you don't find yourself progressing from stress to extreme stress to chronic stress into depressive symptoms, because we don't just wake up one morning and find ourselves in depressive states, right? So if stress is part of every day, then self-care must become a vital part of every day as well. Great. So let's dive into the Inuka method itself. And we talked about the Inuka method capitalizing on already existing data and also the use of coaches. So our solution was basically to train community heroes to provide mental health coaching supported by an inbuilt supervision system that would allow for quality control, right? Because we're all about tech optimization. We live in a digital world, and if we are going to reach as many people as we possibly can, then we need to capitalize on the evolving and the emerging trends in the societies today. And of course, we can't do that on our own. So we work with a very dynamic team that we've been working together with for about 6 years. We are committed to offering the best possible mental wellness or mental health support that we possibly can at the touch of a button. So if you look at some of these pictures, you can see we have a lot of diversity, which also is the Inuka method itself. It is full of diversity, and I'll be able to show you that as we continue on. Now, the Inuka method is actually peer-reviewed and scientifically tested. It tends to incorporate the principles of the problem-solving therapy and cognitive behavior therapy that have been proven to be effective in the management of stress, anxiety, and depression symptoms. The main goal here is to be able to identify challenges in a person's life, work together with a coach to find effective solutions to make a simple, smart wellness plan. Why identify key challenges? Why problem solving? And why cognitive behavior therapy? Because at the end of the day, it doesn't matter who you are. It doesn't matter what phase in life you are in. Each and every one of us has a problem that needs to be solved almost every minute of every day. So let's go from the basics, the most minute of problems that need to be solved. You wake up in the morning and you need to get to the office. How exactly do you get to the office? And every single routine that you have to go through to be able to allow yourself to get to the office on time. So whether you wake up and it's your morning routine, whether it's breakfast, whether it's your commute, whether it's things that you have to arrange before you get to the office, you'll find that a lot of things are actually happening within a 1 hour period, within a 2 hour period, that 60 minutes you can actually do so much in 60 minutes. And if you're unable to get through that routine, to be able to problem solve and figure out what would be the most effective way for me to be able to get to work on time, a lot of the time you'll find yourself getting late, you'll find yourself feeling overwhelmed, you'll find yourself almost wanting to give up and questioning, do you really have to go into work? Because how many times again in the morning have people woken up and felt complete lack of motivation that they didn't want to move or do anything that day? So our goal as Inuka is to capitalize on principles around technologies and theories that have been tested and proven effective to be able to help everyday people be able to deal with everyday problems as a method of reducing depression and anxiety symptoms. So as we were running our pilot, and I believe Ankiza was able to expound more on that at the beginning of our segment, we found that people actually tend to achieve their goals faster when they're working with a coach. And that's not just a statistic that comes from us. The Harvard Business Review also carried out its own data collection and its own research and found that a lot of the time we tend to do things a lot easier when we have an accountability partner. And so we as Inuka, when we talk about capitalizing on data to be able to develop tools that work best for our communities, this is some of the examples that we can showcase today. The Inuka method itself tends to have 7 key steps. The first step is to clearly define and identify a problem. What exactly is the challenge? Why? Because the theory of multitasking. Now, a lot of the time when you think about where multitasking came from an African standpoint, it's something that comes with a lot of pride. It was born out of a woman in the kitchen who is able to actually cook, feed the baby, clean, and do multiple things at the exact same time. Up until today, when we're talking about multitasking, a lot of people talk about it as something that you should be proud of, that you can actually handle multiple things at the exact same time. Now, we've taken that concept as people and we've incorporated it into our problem solving, into our stresses. So if this statement sounds familiar, you'll find somebody waking up in the morning and the first couple of seconds, these are the sentences that run through their mind. Do I have to get up in the morning? How am I getting to work? What am I going to eat? School fees is due. rent is due. I really don't feel like moving. And in that moment, you'll find follow-up statements such as, if I had money or if my finances were sorted, then I wouldn't have all of these challenges, right? So we tend to multitask in our problem solving as well. We tend to multitask with our challenges and then expect that we can find one solution that's going to be able to give us an effective remedy to whatever it is that we're going through. Now, unfortunately, that's not the case. And a lot of the time when people tend to do this, this is why we find people in repeat cycles where they can't get out of depressive patterns. And when you're having a conversation with someone, and it is actually very common, we found it on the platform, we found it on the bench, that someone will tell you, I've tried so many things. I've tried so many different things. Nothing is working. Nothing is working. Why? Because they didn't effectively define the problem. So this is actually one of the first things that we do as Inuka, or with the Inuka method, is teach you how to separate. You not wanting to wake up in the morning, that's a motivational problem. You not sure what you're going to wear or how you want to look that day, that's a self-image problem. You're not sure about how you're going to get to work or how you're going to leave the house, that's a logistical challenge, right? So separate them, because in turn you'll find that for every one problem, there are multiple solutions, but there is no one solution for multiple problems. From there, once we've been able to identify the problem, then we move into setting up what we call realistic goals. Now, when we talk about smart well-being plans, and we talk about realistic goals, is we realize that some of the goals that we tend to set for ourselves end up becoming problem statements in their own right. So you will look at a situation, tell yourself that by this time, I'm going to have accomplished this, knowing fully well that in maybe a span of 6 months, you didn't even come close to bridging the gap into what you want to achieve. So when you give yourself a 3-week timeline, then for sure, it's not a realistic timeline. And all it does is 3 weeks from the day that you set the goal, you're going to sit down and beat yourself up about it and say, listen, I keep on trying and I keep on failing. So generally, I am a failure, right? When we think about depression, what is one of the symptoms of depression? Feelings of low self-worth, feelings of worthlessness, feelings of hopelessness. And all of it can actually be remedied by setting a realistic goal. From there, we brainstorm for solutions. All right, so we've identified the problem. We've set a realistic goal that we can start working towards. But what solutions can we actually employ? What solutions do you think would work for you? Because at the end of the day, what may work for me may not work for somebody else. So with a coach, you will brainstorm through solutions to find what effectively works for each person on an individual level. Evaluate and compare the solutions so that you can find, because you can brainstorm and come up with 20 different things, 10 different things, 5 different things, and some people can barely come up with one. So when that happens, then we will use tools to be able to effectively find solutions that work for you. And then pick again realistic timelines. We're talking about 7-day timelines. We're talking about 14-day timelines. So what solution can you actually try or start working on in the next 7 days? From there, once you pick a solution, then we will have actually completed the well-being plan or the smart wellness plan. And from there, you'll go for a period of 7 days or 14 days before your next session, and you'll come back and we'll evaluate the results. Why do we do it in short time spans? Why are we not talking about solutions that are long-term? Because when we talk about goals, we talk about short-term goals, we talk about long-term goals. The reason we're doing it in short intervals is primarily because every single day when you accomplish a goal, you release happy hormones. Every single time when you accomplish a task, you feel good about yourself. So if stress is part of every day, and this is where we're talking about self-care, stress is not going to say, oh, you're scheduling some time off in the next 2 months. So there will be nothing stressful in your life up until a week before your scheduled leave time. That's not how it works. At the end of the day, stress will make time for itself. It doesn't matter whether you're in a good place, a bad place, you're overwhelmed, things are working out or they're not working out. If a stressor is supposed to happen, it will happen. So with these 7-day intervals, you're able to actually see that as you go through life, you can actually find solutions on an everyday level that make you feel good about yourself, that boost your self-esteem, that boost your confidence, that make you feel like you are good enough and you are worthy of whatever it is that you want to accomplish. So this is why we use it on short intervals as opposed to long intervals. However, there are some goals that with the guidance of a coach, we will be able to help you set longer term goals to achieve. Now let's talk about also what some of our superpowers are as Inuka. Number one is we help you, or we teach you how to become better at problem solving. We equip you with tools that when things go wrong, coping mechanisms, when things go wrong, you at least know where to start. You know, you don't just feel hopeless or feel overwhelmed. You can at least sit down, pull out a pen and paper and sit down and say, okay, let's define the problem. What's actually going on? What is actually contributing to how I'm feeling? And once you're able to do that, what do you want to do about it? We help you learn or boost your confidence to be able to trust in your own abilities. Why? Because at the end of the day, no one knows us better than we know ourselves. So we can have people around us, right? We have people because at the end of the day, as human beings, we are communal beings. We cannot exist in solitude. So we have people around us who can tell us who they think we are, whether we are kind, whether we are rude, whether we are hardworking, or whether we struggle with motivation. We have people who can tell us that. But at the end of the day, we ourselves know why. It's just that we don't know how to effectively listen to ourselves. So we teach you how to listen to yourself as well. We give you better insights into what works for you. And of course, we work with, working to get more positive thinking patterns. We work on what we call perceptual biases. When we were talking about some of the key mental health drivers, some of the limitations to mental health, some of the needs in the earlier segment, it's a lot of the time you'll find stigma is derived from perceptual biases. The thoughts that we have around getting help, especially in Africa. Why? Because if you can't handle what's going on in your life, then you're considered as weak for a lot of the African communities. If you tell somebody that you're going to seek help because you're not feeling like your mental health is at the best place, then you find very stigmatizing statements like, are you going crazy? Do you need to be institutionalized? Are you on medication? So a lot of these thinking patterns are some of the key limiting factors to mental wellness across Africa. And then from there, we help you learn how to reach your goals easier. So how do we actually put this method into play? The first thing we do is we train. And who are we training? We're training everyday people with lived life experience on the Inuka method to help bridge the gap. But what gap am I talking about? When we were talking about the mental health statistics, we were finding that we have one mental health practitioner to about 100,000 people. One person is not able to effectively see 100,000 people at any go. That's why Professor Dixon founded the Friendship Bench. That's why Inuka capitalized, or rather digitized, the Friendship Bench model itself. And this is why we train. We are training everyday community heroes to be able to bridge the gap. So various professionals, we're talking about peers, we're talking about retirees, we're talking about community leaders, every single person with a passion for mental health, looking for positive impact, looking to make a positive impact in society. But of course, not everybody who has good intentions can actually be a coach. Why? Because we actually need a confirmation of empathy and compassion. When we were doing some of the exercises today, or the engagement exercises today, you'll find that there were corrections on statements, on sentence structure. Why? Which sentence tends to sound more empathetic? So you can imagine you're having a hard day. You feel like you're carrying the weight of the world on your shoulders. And the person you're reaching out to is very apathetic or very nonchalant about how they're able to communicate with you. They're not welcoming, they're not warm, they don't make you feel safe. So a lot of the time you may actually leave that session without having said what exactly the problem may be. So this is why we need coaches who have a demonstrated or a confirmed history of empathy and compassion, and we test for the same. So once we train, then now we need to let the community know that we exist. So we go out and we market and we tell people this is where we are at. this is the product that we have for you. We run campaigns at schools, at organizations, in communities. We capitalize on social media just to be able to talk about mental health and try our best to start breaking the stigma, start working to clear the barriers that currently exist so that we can work to effectively give a mental well-being digital tool that everybody is comfortable trying to use or to access. So once we have people coming onto our platform, and I will be able to walk you through the development of the platform itself as we continue on, then we need to screen. Anytime you go to a doctor, anytime you need to look into something, anytime you need to start a research project, a lot of the time we have to start off with a baseline. What's going on? And for that, we tend to use the WHO self-created reporting questionnaire. It's called the SRQ20. Now, this was primarily developed as an instrument for developing countries with lower to middle income class communities to be able to screen also for common mental health disorders, depression, anxiety, PTSD. And the screen actually consists of 20 questions with yes or no answers, and also covers a suicidal ideation screen. So, or a suicidal ideation question. So what are some of these questions that we ask? I mean, if you're going to ask you 20 questions, then some of them would actually look like this. In the last 7 days, have you had headaches? In the last 7 days, has your appetite been poor? Yes or no? In the last 7 days, have you felt easily alarmed or startled? In the last 7 days, have you had trouble thinking clearly? And has the thought of ending your life crossed your mind? Yes or no? Why? Because when you ask questions like this, you can already start to gauge the where somebody is at from multiple standpoints. And once we give this screen, then we're able to put you into 3 categories or class you into our 3-category rating system. The first one is what we call a tough place. Now, a tough place is any single person who scores anything between 0 and 3 on the scale. This basically means that this person either answered yes to the question around suicide or suicidal ideation, that they have indeed thought about ending their life, or that they are currently in a very difficult situation and finding it very, very hard to deal with the stresses or whatever life is throwing at them in that particular moment. Next, we have the at-risk category. Now, this is almost the midpoint. It basically means that from an analysis point of view, that this person basically has been able to cope with stress up until this point. So either the stress has become a bit too much, it's become a bit too overwhelming, or they've been dealing with it for quite some time and they're actually losing their resilience capabilities. So now they are more at risk of burnout, more at risk of depression, anxiety, more at risk of what we call common mental health disorders. From there, we also have the resilient scale or the resilient category. This basically means that for this person, they have effective coping mechanisms. They're not immune to stress, but whatever it is they're doing, whether it's from a self-care standpoint, whether it's from an actionable standpoint, they're actually able to cope with whatever stresses life is throwing their way in that moment. So this is basically how we also get our pre-screen to establish the baseline. We offer the SRQ20 on 4 platforms or in 4 different timelines. So the first one is the moment you join the platform as a new user, you will take a well-being scan or the SRQ20 so that we can establish a baseline and see where we're starting. From there, when you start a program, and our program can have anything between 4 to 8 sessions, at the midpoint, we'll take another screen so that we can have a progressive check. Is the intervention working? Are you responding to the Inuka method? Or do we need to actually go back to the drawing board, re-strategize, or reintroduce some new tools that can prove to be a bit more effective for you as a client? Why? Because every single person is unique in their own right. So again, what may work for me or what tool may work for me may not work for the next person, and we'll need to reevaluate that to make sure that you get the best out of your mental wellness program. From there, at the end of the program, either it's a 4-session program or an 8-session program, we will give another SRQ screen so that now we can start to tabulate impact metrics. Once you complete the program, we then let you go for a period of about 3 months, and then we will reach out to you and ask you to take the screen again, check in, do a wellness check, see if you're doing okay. And the reason we're doing that is so that we can get what we call sustainability data. That how effective is this Inuka method? When we're talking about developments across board from tech to mental health or to health in general, we're also starting to look at emerging trends, like something we'd call single session therapy. So as opposed to doing 4 to 8 sessions, how effective would one session be? And we're able to actually collect all of this data as we still provide the intervention to Africa. Great. So we've talked about the intervention, we've talked about the method itself. Now let's move and actually put a product onto the ground. So how did we actually move from what we were envisioning from our prototype into product? Number one, our innovation needed to serve the community at large, and it needed to serve the community on 2 different parameters. 1, from our client standpoint, and 2, from our coach standpoint. From the client standpoint, our client needed to be able to, 1, access our system, and this is where user experience needed to come in. It needed to be seamless and easy. Because remember, when we're talking about our target audience, and we'll cover this a bit more, people who are struggling with common mental health disorders, people someone who has depression, anxiety, they're not the most tolerant of people, because a lot of the time they're already feeling quite lethargic, they're already feeling very tired, they're already feeling like they don't want to move and they don't want to do anything. So if you don't simplify this process for them and the process feels hard, a lot of the time they'll not even bother to try. So we needed our product, or we needed our Inuka platform to be able to meet this demand in such a way that the client can easily access us, go straight into the well-being scan with prompts, and we'll be able to show you this, follow easy, simple steps to allow them to take the scan, be able to match with a professional of their choosing, or to match with a certified coach of their choosing, be able to book their session, be able to access their well-being plan all on the same screen, and then at the end of the day also receive booking reminders. Why? Because sometimes today you may be feeling like, okay, I need to talk to someone immediately. You have a really good conversation and then life happens and you forget about your therapy session or your coaching session per se. So this would actually help maintain consistency in the session so that people are actually able to complete their programs. From a coach standpoint, our coaches needed to be able also to access the system, be able to get notification of any booking so that they're actually prepared and present for the coaching session itself. They needed to have, they need to be able to see the well-being scan results, or the SRQ results. They needed to have in-app support tools. So when we talk about in-app support tools, we're talking about our empathetic scripts. We are talking about our referral parameters. So of course, remember, any single person who at this point has fallen in a tough place category, has scored a 0 to 3 or is suicidal, will actually need to be referred to the nearest psychiatric facility, general doctor, or hospital, primarily because, as earlier mentioned, Inuka is a preventative tool and not a diagnostic tool. So then from there, also be able to have the referrals at the touch of a button so that they can actually use it during the coaching segment of things, or the coaching conversation, and communicate or have a communication interface that's easy to use so that they're able to get everything that they need at the click of a button. From there, the platform also needed to be able to provide what we call supervision systems, with supervisors like myself being able to log on to the platform, do a quality control check to ensure that everything is going, that the method is being followed effectively, that the client is getting everything that they need, that the coach is comfortable and not struggling. And our platform needed to be able to meet all of these demands. And from there, the system also needed to be able to tabulate how many sessions a coach has had so that that can be replicated into payment systems. So in a nutshell, this is the platform that we needed to build. So what were some of our key considerations? 1, what was our product? Or what is our product, and why does our product exist? Why mental health? Why a digital solution? Who is going to be our target audience? And so we realized that there's so many people out here who are in need of mental health support that we actually needed to build a product that could work for almost anyone. And this is where the diversity or a one solution fits all as part of the Inuka method that we actually started to develop. 3, what did we already have? Because we couldn't start from zero. So we had the data from Friendship Bench, which is our parent company. We had the data from the World Health Organization. What else did we have? And what did we need to build upon? To be able to develop the Inuka platform itself, what else did we need to build? What were some of our key considerations? So when we talk about key considerations, we're talking about simplicity, we're talking about ease of access, we are talking about culture. When we were talking about some of the limitations and the drivers, we're talking about cultural norms, we're talking about perceptual biases and how those actually limit accessibility. So these were all considerations that we actually had to make as we were building this platform. From there, we needed to, because we are talking about a digitized product at the end of the day, what type of online platform did we need to develop? And from there, when we're talking about tech in Africa, as much as we're talking about Inuka being tech optimized, how many people in lower to middle income communities actually have access to decent phone connectivity? So if we're talking about using a 4G or a 5G in an LMIC community, you'll find a lot of the time we're going to have a lot of connectivity problems. So what type of integrations did we have to make to be able to effectively meet our target audience? And for that, we were able to actually integrate into WhatsApp. That for Inuka, for our coaches, for the Inuka team itself, we would be able to go to the online platform and use our Inuka interface. But for all of our clients, if they were not able to go to a basic browser, if they had basic connectivity challenges in the sense that you're using 2G or 3G, then all they needed to do was actually go onto WhatsApp, type hi to our Inuka number, and from there they would be connected automatically to our back-end customer service, where we would be able to walk them through, send them links to the well-being scan that they could actually still take on WhatsApp, and also have their coaching session on WhatsApp. So all in all, simplify the journey as much as possible. From there, we also had to think about our data protection protocols and what role cybersecurity also played in the development of our platform. Because at the end of the day, when we're talking about mental health, we need to talk about confidentiality. It's key. For any practice, confidentiality is always key. So if there was a risk that you would come onto our platform and basically talk about some of the stresses that you're going through and be worried that you'll later find it somewhere on some social media platform, then definitely you'd not come. So we follow strict European GDPR protocols in relation to our data protection. And then we also needed to think about our key maintenance parameters. Why? Because if we're looking at a target audience of almost every single community that we can possibly reach, then does that mean that every single time we have a new project, we go into a new community, that we will have to adapt, we'll have to integrate, we are going to have to build again from scratch? And what would that mean in terms of time? What would that mean if we have to innovate every couple of months? So these are some of the key considerations to be able to develop a platform that would work, that could easily be maintained. And even if we had to integrate, we'd not be building again from scratch, but again, optimizing what is already there and integrating into that. So these are some of the key considerations that actually helped us build our platform. Now, once we built the platform, then we were ready to hit market. And all a client needed to do was literally go to a browser or go to a phone number that we were providing, of course, through our various marketing campaigns, type out app.inuka.io, and the first page that they would get is this interface. And it already has a lot of kind of guidelines as to how you can start off. So of course, you can do the self-scan, you can book your own personal coach, and of course, simple steps that can make you feel better. Our platform is anonymous and confidential. which basically means that as you're starting up, every client, or we call them coachees, would be able to create their own personalized accounts with an email address and put in a password of their choosing. Automatically, once that is done, then a unique username will be generated for them. Why did we do that? Because when we're talking about strict data protection protocols, then we're talking about the person who is responsible for pulling data from a client standpoint. How many users do we have on the platform? And the person who's responsible for quality control, in the sense that they may be able to see a transcript and assess whether the coachee or the client got the best possible service, cannot have access to the same data. So from a customer service standpoint, from a user standpoint, we'd have one person who can only access email address and unique username, and that's it. From a quality control standpoint, then the person handling quality control can only see transcript and username. And at no point would any of this information overlap. So when we talk about confidentiality, we're not just talking about protecting ourselves from cyber attacks. We're also talking about ensuring data security within the organization as well. So that's why you find the username is generated from the word go. So once they log into the platform, they will have prompted steps that basically guide them as to why, or basically ask them why they're on the platform. So one, are you here because of relationship challenges, work challenges, generalized stress, or you're not even sure? Because sometimes you could feel like you're not okay, but you don't know why, because you still have no idea, or you don't know how to pinpoint the actual problem or what's going on. So once that happens, then they'll receive a prompt to either book a session or to start the scan. So if they click on start scan, then they'll be able to go to the 20-question SRQ and answer the 7 questions. You know, have you had headaches? Has your digestion been poor? Has the thought of ending your life crossed your mind? So once they're done with the scan, they will get their results immediately. And they'll be able to see, like, for example, this particular tester had a score of 13, which basically meant that they were at risk. And what were we actually looking at? Those 20 questions, we were actually checking to see how you're feeling. How's your body feeling, right? If you're not feeling very well physically at the moment and you have some complaints, you know, if you have a headache and your body just feels off, then generally you're also off. So on this side, the coach is actually also able to see these results and be prepared for the session. Because if you have someone who has answered yes to them having frequent headaches in the last 7 days, highest probability you're finding somebody who is going to be a bit more irritable than most, because at the end of the day, they've not been feeling okay. It's human nature that when you're not feeling okay, you're not in the best of moods, you're not in the happiest of spirits. Then we'll also screen for your energy levels. So is your energy, you know, normal? Are you feeling good? Are you feeling energetic? Are you feeling lethargic? Are you feeling fatigued? If someone is feeling fatigued, then you know for sure they're not looking for a very long session, because at the end of the day, they primarily want to rest. And as much as they want to talk about what's going on, then they don't want to be seated somewhere for, you know, 2 hours, 3 hours. So the coach is also able to gauge and prepare effectively for the session. We'll also gauge from a mood standpoint. Are you generally okay? Are you feeling more sad? Are you more gloomy? What's actually going on? And then we'll also gauge from a purpose standpoint. Why? Because how motivated are you? Motivation is key when it comes to everyday life, because my motivation is what's going to make me move. Motivation is what's going to make you get out of bed. It's what pushes you to get to work. It's what pushes you to socialize. That's exactly what pushes you to be able to live life. So we also gauge for motivation. And then from there, our client is able to actually book a session. And when they book a session, then the first thing is, which day would they like to have their session? Any day between Monday and Sunday is a good day for us. We try to offer, or we try to have coaches on standby, 24/7, which means every day from Monday to Sunday, if you come onto our platform, then there will be a coach who's ready to talk to you. Once you pick the day, Then now we go into time. What time works best for you? So as you look at the time, you'll also find that there is actually a list of available coaches, and each coach actually has a small bio that helps the coachee get to know a little bit more about their coach before they pick. The reason we do this is we give control to the client, that they choose who they want to have a session with. They choose when they're comfortable having a session with. Why? Because we found that when people take ownership of their wellness journey, then they tend to have better results as opposed to if the wellness was actually forced upon them. And you'll find on the far end side, there's also, again, a very simple step-by-step guideline as to how you could be able to book your session. So all you need to do is pick your time. And once you pick your time, then now you'll be able to, you'll go back to your homepage. And this is basically what the client homepage would look like. So there is a segment that will tell you about your upcoming sessions, with which coach, what type of session you're going to be having, the date and the time. And of course, there's an option to add this to any calendar of your choosing. You'll also be able to see your Inuka journey. So in this instance, how many sessions have you had? How many well-being scans have you taken? Or how many self-scans have you taken? You'll also be able to see your most recent results from the self-scan. And when you click on the little icon that's named progress, just at the top of the results there, I'm talking about this one here. I don't know if you can see my cursor. You'll also be able to get a graph of your progress. So if you started off with a score of 4 with your first baseline test, by the time you were doing your mid-screen and you moved up to 7, by the time you were doing the end of progress or end of program screen and you moved up to 17, then you'll actually be able to see which day you took the well-being scan, what your score was, how many sessions you had after that, and what your improvement metric was from a personalized standpoint. From there, also, you have a Q&A section or a FAQ section where you can actually directly message us in case you have any questions, or you're not sure about your booking, or you'd like to change your booking, or basically any points of query that you may have, and somebody will be able to get back to you on that. And also a little interface where you'd be able to talk to your coach, either through offline messages or transitioning into your sessions. So in a nutshell, this is basically what our interface looks like, and this is what we were able to develop in terms of digitizing or offering a digital solution to mental health for Africa. Right, so of course, our digital solution that makes mental well-being accessible at the touch of the button. So this is just a quick overview or a quick recap of everything I've been able to walk you through. Starting from our first stage, which is, of course, activation, engagement, and introduction to our platform. Then the ability to be able to take a well-being scan. From there, connect you to a coach and referral solutions, depending on where you're at. And then also be able to give you systemic reports so that you're able to track your progress. So remember, our platform is anonymous, it's confidential, it's accessible, and it's an available solution to all. So all you need to do is have either a device that can allow you to connect to any GSM signal. So we're talking about 3G, 4G, 2G, have a browser or even Wi-Fi wherever you are in the world, and you'll be able to access a coach. All right. So I know I have been talking for quite some time. I believe it's been 40 minutes so far. So at this point, please let's take a break. Ankiza, I don't know if maybe you can help with the break part.
Yes, hi. So I hope we've all been following along. Please remember to use the Q&A section to go ahead and ask questions, even though we will have a section where we address questions later on. It would be great for you to continuously ask questions. That way we also have time to review. And if we need to have more detailed answers, we can have some available. Thank you so much for your reactions. It lets us know that you're with us and you are following along. I really hope that you are taking notes. You are really enjoying kind of our process. Now, we'll do a bit of a stretch before we get back into it. So for those of us who can, whether seated, whether not, I would like us to put our hands up in the air, especially if we've been sitting a lot, and just simply hold both hands up and actually stretch backwards. So you can see I'm pulling my hands behind my head in this fashion. It's really important to stretch our back muscles in the age of webinars and constant online meetings. It's really important to do so. So let's hold there. I'm going to count down from 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And let's release our arms out. Now I want you to have both hands like as if you're pushing against the wall on both sides, okay? So let's stretch out. Let's push as hard as we can as though we're holding two walls together. And let's count down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let's bring our hands in, center ourselves, and let's now look up and down with our head, looking down and up, yeah? So let's do that 10 times. I hope you're all following along wherever you are. So we're going to put our head all the way down, stretch those neck muscles, and back up, and down again, and back up, and down again. And back up. So this is really important. I think we're all understanding the importance of self-care and physical exercise. Great. So now we can breathe out a bit, okay? And we will swiftly move on. Maybe before we move on, I'd love to hear in the chat kind of key takeaways, like just really just one word, literally, what has stood out for you so far? Please use the chat to share, you know, just one word answers, a quick fire round so that we can see what is sticking with you all. Please go ahead as Charlene changes the slide for me. Great, so please use the chat, everyone. For those of you who are new or joined a bit late, we're using the chat to make sure that we stay connected and this session remains interactive. We are doing this in hopes that it helps you, future innovators in mental health, really expand upon maybe the work we've done or come up with a whole new innovation. So we have some keywords here coming out: effectiveness, creativity, innovative, brilliant, perception biases, very good one, community, fantastic. So really we've seen this prototype to product. And maybe go back one slide. And I just want to address some key things in the product to prototype, because someone asked earlier on what didn't work, right? It's very easy to have the impression that it all worked out very easily when it did not. And I think I want to just focus on 3 key areas that, you know, we failed miserably on, but we learned amazingly on. We initially came out with an application. It was an app that was available on Google Play Store. And, you know, we had limited resources, of course. We did not have unlimited funds, very limited resources. And a lot of the time, you know, we did this research rather manually. So there was really no big tools we were using. And what we found when we launched the app is really 2 key things. On one hand, the app quickly had a lot of downloads. So we had over 4,000 to 5,000 app downloads at one point. But then the drop-off rate was really, really fast. And there were two main things we came to realize. Is one, the app market is a whole different market in itself, that often apps that perform well, especially when we look at LMICs, is normally in the entertainment sector. And actually that's also global. Now, we're not proud to say here that betting apps do well, news or media apps do well, things that have a lot of fast-moving content, right? A lot of instant gratification, and not really apps to do with educative or, journeys of self-help, self-development. And so we quickly came to realize that the app was not performing when it came to the stickiness factor. And also, second to that, for the application was performance issues. I think Charlene mentioned, we had to pivot very quickly because of slow or lagging times, low connectivity, long load times. And we quickly realized, of course, that, even though most of us on the continent have some type of phone, internet connectivity is still an issue. And when we looked at a lot of the research, and don't forget, this was around 2018, pre-COVID, we still found that apps like WhatsApp were growing rather fast. I mean, nothing compared to how fast it's growing today. But we quickly realized we needed to find a way of integrating our platform with WhatsApp to address the fact that WhatsApp is become critical when it comes to sharing content, news, and all its functionalities that eventually became voice notes and all that. So the app was not a success for us. And so WhatsApp was really the innovation, or the integration of WhatsApp came out of this failed application. The second one was research. When you are innovating in a new field, or a field that lacks a lot of data, like mental health in Africa, and this is again starting in 2017, people always don't know what they want. They don't even really understand what it is you mean. So you can conduct a lot of interviews, a lot of surveys, but ultimately it's in the doing, it's in the process of them experiencing it that they get to understand what it is they need from what you have. So we had to have a lot of reiterative processes. And that was also quite time consuming, because we had to educate, and I think I mentioned earlier, right? Psychosocial education, and also in the chats came out quite a lot. There's a need to educate on what it is, what expectations to have, what it's not, and how also it benefits the person or people or communities at large. And then the last one was with regards to making sure that we were always in contact with other stakeholders, not just the client, but advocacy groups, influencers in the mental health space, civil society organizations, and mental health providers and professionals. It's really important to form these partnerships and research institutions, and form these partnerships, because ultimately we needed several stakeholders in order to have a holistic product. We could not do this just with our client or just with ourselves. And then, of course, along the way, even as teams and having to lead dynamic teams myself, you have to evolve, and evolution sometimes means letting go of people and adapting your mindsets to the shifting ways. Africa is a very dynamic market, and oftentimes a lot of people who try to enter the market and fail, you realize it's because the time it takes to make the adaptations is too long. And you need to be able to adapt your product very quickly in order to meet this dynamic market. So that was just a bit of an overview to say, you know, we had a lot of failure along the way. And it's not been an easy journey, and it's an ongoing journey, but it's important to really understand that. So we are a product, we are, you know, now officially live. And again, you know, we went from prototype to product. So we look now at section 5, data, evaluation, and reporting. One of our superpowers, I think you saw on Charlene's slide, we like to talk about superpowers because you should really be able to know what are the superpowers of your innovation. What is it that allows you to excel? And one of the things that is our superpower is the fact that we collect real-time data. You know, think of the classic case. I go to a psychologist, I sit down, I have a session with her. Granted, she may do some general baseline assessments, but it's very hard for me to really know and take ownership over how I'm doing in the long term, session by session, right? And what we're able to do rather well is we're able to track real-time results. So somebody comes in, you know, and we're able to see not only their baseline results, which are very important, but as Charlene mentioned, transcripts. These are the anonymous chats that people are having with their coach. And through this data, we're able to understand key areas like what we call thematic issues or sentiment analysis, or, you know, drop-off rates. You know, is there a conversation that happened and the client ghosted the coach? You know, and to understand all types of different metrics that allows us to not only improve upon our own knowledge. If we see a lot of thematic issues on gender-based violence or a lot on addiction, you know, we're quickly able to also upskill our coaches, make sure that they're well informed on certain key areas that are coming up. But also from the client perspective, they're able to feel like they have ownership, right, of this process. So they literally have a dashboard where they're able to see, in their view, their well-being over time. And we always compare it to tracking your steps, right? Every day, if you want, every week, every month, depending on you, you're able to do that. Now, from us, anonymously, we're able to look at regions. You know, where are most of our clients coming from? How much time are they spending? What are their ratings in terms of how are they rating our coaches? How are they rating our platform? You know, when and what specific times or seasons are they coming? Does it coincide with world events? Does it not? And so we're able to collect all this data. And here you have some of the charts, just a quick snapshot. So even for us, whether it is from a project point of view, we're running a project and we want to collect this data to show impact, whether you are an organization that is trying to track the overall well-being of your staff at scale so that you're able to see, you know, if 50% of my staff are at risk or on the verge of burnout, then I have a serious human resource problem that at the end I need to address urgently. Now, we have a certain cutoff time. So 20 participants, no less than that, because we aggregate the data, right? So if it's a small company of 3 people or 5 people, of course, we are not going to share this data. But for larger data sets, we're able to aggregate it and then give this anonymous data. Next slide. So this is what it looks like. Also, you know, there's various ways, but people come in, they're able to, for the reporting purpose, we're able to see how many people did we, you know, send a link to participate, how many registered online on the platform itself, how many have booked a session with a coach, how many well-being scans have been done. This is the second bar chart. how many are resilient, how many are at risk, how many are in a red zone or danger zone. And then, of course, over time, we're able to compare, are the 19 people who are at risk actually improving? Is it going down, the at-risk population, or is it going up? And then ultimately also looking at, how many people complete sessions, which is also very important in any innovation. It's one thing to get people to book a session. It's another one to get them to complete sessions. Because don't forget, our coaching methodology is based on research that says it usually takes about 3 to 4 coaching sessions, which are between 30 minutes and 60 minutes on average, for someone to have scores that go from at risk back up to resilient. So, of course, it happens, and especially in African context, we find that after one session alone, somebody can literally jump from at risk 19 at risk score number 11 to 13. So by that, I mean the at risk is a scale. So they may move towards resilient, even though they may not get back into a green zone, right? So we're able to see improvement point scores. And this is very important in order to measure impact. So I think it's really key to have an impact measuring tool inbuilt into this whole innovation, especially when we're talking mental health. So really, again, these are very high level reporting samples, just so you have an idea of the kind of reports we pull, the kind of data, and what helps us actually even in writing papers and hopefully publishing them. So we really look at our reach, what's the population of people we're trying to reach, how many of them screened successfully, how many took a coaching session, and then what is our pre-measurement, post-measurement, and even 3 to 6 months post-measurement results, right? This is what we're trying to track, to really be able to validate the impact we've had. And then we look at what we're calling points increase, because the SRQ is based on a score of different points. Yeah, next slide. So we wanted to ask a question here and take kind of a short reflection break, not so much a physical break because of time. And we wanted to ask the question of, you see here a mother lion with her cub. And this is a reminder to what we mentioned earlier about support systems, yeah? Going back to our coaches who serve as support systems, we'd love to hear, who are your support systems? Who do you rely on in your time of need? Or even if it's not a person, what do you rely on in your time of need? What are your support systems? So please let us know in the chat what your support systems are, and we will read those out as you share with us. I think I wanted to ask Sylvia a question. Sylvia, are you with us? Could you share your support systems?
Yeah, thanks, Ankiza. Do you mean as an organization or as an individual?
As an individual.
Okay. I reach out to friends. So I think for me, it comes out very strongly that I have a close network of friends that I reach out to now and then. Yeah, that I can say anything and not be judged in any way. So that makes a huge difference.
Wow, thank you for that. Yeah. Friends are really important, and we're very lucky if we have those type of friends, right, that we can confide in. Somebody says here, my faith, my family. Another person says my parents and a few close friends with whom we share common goals and aspirations. Somebody says workplace colleagues, which is also great if we have supportive colleagues, and very important as we spend so much time at work. Somebody says friends. So it's good to know that we have support systems and structures, right? And we're very lucky if we have them. Somebody says, again, my family, we're very lucky if we have them, but we also take for granted how many people don't, especially when it comes to now the more difficult conversations, right? Or the more difficult issues that we're dealing with. We have normally our, public persona, private persona, and then even beyond the private persona, we have those secrets or those things that maybe even one person in this world knows. So sometimes it's really important to understand there are different levels of us, and some people are very lucky to have friends and family who they can speak on, to everything, and some of us really need coaches or people who we can confide in anonymously without the fear also of any repercussions. So let's go to the next slide, Charlene. So now we look at section 6, right? Our work and our impact. So one of the areas that Inuka focuses on is we do have a global reach. The great thing about being digital is we do not have to limit ourselves to country. I mentioned we were very excited, even though it's a very challenging time, to now be working in the occupied territories of Palestine. We're looking at war situations where people, cannot physically go anywhere, but are desperately in need and suffering from PTSD and very other challenging mental health situations. And so we are currently providing that support in occupied Palestinian territories. Now, we also have here a total of 10,000 people have been reached, mostly in Africa, but across the world. So the whole peer-to-peer approach that we touched upon earlier it's important to note that we train people in the communities where they live or serve. So we want to give some examples of this, and examples also of how we had to customize and adapt our innovation to meet those needs. These were just some high-level projects, but we'll just focus on about 2 or 3 today to give a bit more of a context on how implementation on the ground looks like. Next slide. So we start here in Kenya. Really, one of the key projects we worked with and are very close to our heart was healthcare workers, frontline healthcare workers specifically. Post-COVID, we had nurses and midwives specifically dealing with unprecedented stress, dealing with a strained healthcare system, limited resources, extremely high levels of stigma in healthcare community, right? A lot of the time, you are the doctor, you are the nurse, how can you be unwell? How can you be sick? So what we eventually did is we had to partner with various stakeholders, some of which are below. So policymakers, Ministry of Health, we had to also include all key nurse and midwife associations, the nursing councils, hospitals, both public and private. Most of the ones we worked with were public across Nairobi and Machakos County. And what we first started doing is we started co-creating. So even though we have, if you like, the product, this product is not a product that you just put in front of the consumer or user and expect them, great, here it is, use it. There is a lot more that goes into optimizing the product for the end user. So we had to conduct a co-creative process where we got together with nurses and midwives from different facilities, different hospital levels, and different lived experiences. And we had to identify with them through various focus group discussions, not only what were perception around mental health, but also their experience with technology, among other things. And what we concluded was that nurses and midwives really have no time. I mean, doctors have no time. These are not people that have time to connect. In fact, they are overworked and overstretched. So we realized very quickly we needed to do two things. One, we needed to make sure that we meet them where they're at. And oftentimes where we were meeting these nurses and midwives, not physically, but metaphorically speaking, was a lot of them would be doing night shift. And night shift, anywhere between midnight to 6 a.m. or 7 a.m. in the morning. And this was the quiet time where they actually had a moment to now check in with themselves and connect with a coach and have a moment to debrief. So we needed to make sure that we had a sort of night service, which we don't normally provide. And then we also realized there was a lot of negative bias or perception, I should say, around mental health. Extremely high suicide rates, particularly among healthcare workers in Kenya, of suicide attempts because of the stigma. And so we went into several different facilities and we started almost a team building approach to it, where we were able to create safe spaces for conversations and ensure that people had testimonies, shared conversations and experiences to draw upon. And from there, we were able then to recruit what we call ambassadors. These could be mental health professionals who are influencers, who are advocates in their own healthcare space, managers at facilities, to make sure that these were the advocates we were using to champion mental health. And then we trained them. So this became Kenya's first peer-to-peer mental health support network for nurses and midwives by nurses and midwives. And what we did was we provided psychosocial support to over 4,000 nurses. And we were able to do this both through online. So 48% there was actually online. And 50%, surprisingly to us, was through physical. And how we did the physical is once we went in and we mobilized groups of people, we were able to innovate and have what we called group coaching. We initially had one-on-one coaching, which was strictly online and chat-based, but they actually needed to connect with each other, which we were quite surprised about because initially there were high levels of stigma and fear, etc. But once we were able to really help them identify their shared experiences, they really took it upon themselves to have these group coachings. And we're happy to say that they are still continuing on with their physical peer-to-peer coaching during their own continued development education segments that they usually have once a week. So this is really important for us because it really showed how important the group dynamic was. And the figure here of 1.7%, which surprised us, was now the one-on-one chat. So which means that most people enjoyed online group coaching and physical group coaching. So it really speaks to the healthcare professionals' need to sort of connect with each other. And we facilitated that, of course, by equipping them with the tools to do it. So that was a project we did in Kenya. And of course, there's several metrics there that we gathered and of course, shared back with the Ministry of Health and shared back with Johnson & Johnson and of course, all the nurse associations. And it's very important because at the end, when we say healthcare workers are not doing well, and there are very many and valid reasons for that, we didn't have data around it. We weren't able to say out of this sample of 4,000 nurses and midwives, actually 50% are at risk. Maybe another 20% are in a tough place, which would require now additional medical support, and the rest were resilient. And then this is how we were able to track improvement and impact, as well as have a mini innovation, which was group coaching, which we had never thought of conducting teams online of group coaching. Next slide, Charlene. So in Uganda, we also had a similar partnership with Strong Minds. Strong Minds is also an NGO that works specifically with women who are dealing with depression. Again, maybe for some context, this one was now during COVID specifically. These women were dealing with high levels of GBV. I think we can all agree with COVID, we saw a really big increase across the continent in GBV. They had now limited support systems. They could not go to specific women groups or other groups of support, cut out of social support networks. And we saw a big rise in anxiety and depression symptoms. So what we did with Strong Minds is we had to also look at partnering with both traditional media, social media, community health workers, different stakeholders, in order to now mobilize this group of women. And let's remember, these women also were very remote. So we had that challenge again of making sure that we were adapting. Luckily for us, we had already integrated WhatsApp, which helped. But in Uganda, if you're all aware, there is high tax when it comes to that. It's not free as it is in the case in Kenya or maybe some other countries where when you buy bundles, you're able to have access to WhatsApp, etc. So we had a lot of challenges there, but through a national campaign that was supported by Strong Minds and TikTok campaigns, etc., we were able to work with these women through primarily voice coaching. So if you remember, we started off offering one-on-one chat-based coaching. Then we've evolved to group coaching. Then we evolved to voice coaching. So we're really adapting to the situation and using technology, because ultimately the tool is only a tool. So it's not so much about the platform. It is about making sure that however we deliver also the coaching is effective. And of course, we want to ensure that we still meet people where they are. So with that particular case study, we were able to help close over 600 actually women. And there was a split of tele, which is voice coaching, and chat coaching. Of course, when you're dealing with rural communities, we're looking also at more challenges when it comes to literacy rates, when it comes to all of these other factors. So this is why also a lot of the time we look and we co-design with the end user. Next slide. Great. So now we have digital solutions. So for LGBTQ specifically, community living with HIV/AIDS and hate crime. So in this particular case in South Africa, we also partnered with a research institution, specifically trying to tackle the challenge of not only offering anonymous support to LGBTQ living with HIV/AIDS, who have very low uptake of medication, but also dealing with hate crime, no support systems, high level of trauma and depression and anxiety. And so we worked there with pop-in clinics that are sort of medical clinics there. We worked with LGBT support groups and of course, clinical also officers and people with lived experience. And what we found was a lot of it is what you call trust building and credibility building. So you'll find that with these communities, of course, they are very apprehensive of who is coming in and what the intentions are. And that's across communities, whether it's healthcare, whether it's LGBTQ, whether it's rural women, you know, people don't know who you are. And it's a very important thing to make sure that you include them in the process. That way they have ownership. And we know that when people feel empowered and have ownership, they're more likely to stick through different programs and really continue on to see the benefits of it. So we took members of the community and we trained them in the Inuka coaching method. We were able then to have them in the pop-in clinics, support fellow members of their community, and really make sure that there was a safety first approach and that we were able to use voice communication again and follow up very thoroughly with them. And so the impact overall, this is an ongoing research that we hope to publish at the end of this year. So we are expanding on it, but for now we have, you know, over 100 sessions done that show continuous improvement metrics across sessions. And participants are now taking medication. There's so many other benefits that we haven't obviously gone into today. But it's not just about mental health, right? It's about all the other positive consequences of addressing poor mental health. So there's a lot of positive results, and we do hope to share with you all at some point more of our published research once we get to that point. Next slide. So really, what have we been learning? You know, and what are some of the key things? I think I would also like to put this question to you in the chat. You know, what have you learned and what have you taken away so far? There has been a lot of information. This has been quite an in-depth seminar, and I think we're almost now at 2.5 hours. But what have you learned, or what have you already taken away? How, and this is kind of a little overview that we've shown, is how do you ultimately get to a point where you transform people's lives and help them achieve life satisfaction? So please use the chat, everyone. Let us continue to hear your thoughts that are very important for us on what have we learned, what has stuck out for you as we go to the next slide. So next slide. Oh, are we, Charlene, are you there? Can we showcase the video?
The discussion bit.
Okay, not the video?
No.
Okay, so maybe as you share, what have you learned? What has stuck out? We would love to see that. And also don't forget, please, to post questions already in the Q&A. So that way we can answer as best as we can. And then we want to also have a discussion. I'm not sure, can Joel, are the participants able to unmute themselves or not? Do we have to use the chat?
They can unmute. They can raise their hand and we can unmute them.
Okay, fantastic. So you can raise your hands and you can also be unmuted. So let's have a discussion first of all. And I see there's already a hand raised, but let me read out first some of these discussion points. What are some of the ways that you think we can improve our innovation, given what you have heard? How would you improve upon our insights, learnings, and research? And what gaps do you think we haven't covered that perhaps your innovation or future innovation could cover? So great, we can unmute. Charlene also will show herself now on screen so that we can both address some of these questions. And yeah, I think I'll give it over to Joel to unmute people with their hands up. But let me also share as you're unmuting here for people who are chatting. Somebody says, I have learned that Inuka is a long-awaited solution for Africa in generating mental health data. Inuka has made mental health help seeking very easy. So somebody says here, what I have learned, being able to reach people, touch their lives positively through technology, which otherwise would not have been possible physically. Great. We can unmute any participants. Please feel free, don't be shy. Raise your hands. We'd love to hear your voices now. You've been listening to us for a long time. Can we unmute Priska?
Hello, how are you?
Good.
Do I get to ask my question, or do I get to first of all answer the ones in the discussion
Let's make
slide?
it either or. Yeah, you can ask your question if you feel like it, or answer the discussion, so we can make it a combination.
Okay, so I would like to do two. I will share one thing on your discussion slide, and then I'll ask my question. So in the slide that you shared about organizations that you have worked with, particularly hospitals in Nairobi, I saw Nairobi Hospital and also Coptic Mission Hospital. For instance, Coptic Mission Hospital gets a lot of deliveries. For instance, mothers are seeking to deliver their babies at Coptic Hospital because the cost is lower, and it's also a mission hospital, so they are more patient-centered. About this gap that you haven't covered, did you come across any data or any statistics on mothers who have encountered maybe postpartum hemorrhage, that is bleeding 24 hours after delivery, and how it has affected their mental health? Because it is one of the issues that is affecting our country right now in the sector of maternal health. Did you also get to talk to some of these mothers who are still at the hospital, or maybe even healthcare providers who have managed to handle their issues? And the other question that I have now, or do you want to answer that? Then I got the question. It could be a bit too detailed.
Charlene, maybe I put it over to you.
Thank you for your question. So first, to kind of answer who we were able to speak to at the respective hospitals. So the partnership that we had with the hospitals was for a specific project to be able to offer mental well-being services to nurses and midwives. So we were not able to actually speak to the mothers and kind of do any research in relation to mothers' postpartum depression or hemorrhage. But when it comes to the healthcare providers, we were actually able to speak to the nurses, and these were some of the thematic to address, or some of the factors that were actually coming out when we were offering support, because our project was named Care for the Caregivers. So we were first offering to nurses, and then as we continue to kind of break boundaries, bridge gaps to be able to reach communities at large. So that's where we were partnering with Coptic Hospital per se, for the nurses specifically.
Okay, I understand. So I realized that this as so maybe we would like to take it up as a challenge. There are
Sorry,
some.
are you
Can you
able
hear
to?
me? Hello.
Okay, yeah, much better. Please go ahead.
Now after you explained the research you were doing,
Priska, maybe you can use the chat for the second part of your question, because we're not able to hear you. So Joelle, maybe you can unmute Priska and we go to Inuka, but please use the chat and we'll read out your question. We can unmute Inuka.
Hello.
Hi.
Good afternoon. Thank you very much for this insightful presentation. You guys are doing a great work over there. and you're reaching out to the whole world. Thank you very much for this project. And I just want to contribute to the discussion here, the three points outlined here. What are some ways we can improve innovation given what we've heard? Well, to improve on this innovation, number one is I don't know how you can connect the primary health care, because really our psychiatrists in Africa, they're in the tertiary healthcare, but there's still WHO gap, mental health gap interventions, which is meant to train primary healthcare so that they can also provide a level of care for a common mental health disorder. So I'm looking at how I know you said that you have community collaboration, but I mean, in a way that it will also connect the primary health care, maybe at the referral level, or to provide a level of physical intervention if there is need. It's a way the primary health care workers can also be trained if there is a need, a dire need for physical intervention. I think that one will make use of, will utilize the image gap of the WHO in a way to hybrid the Inuka. Then number two, how will you improve on our insight, learning, and research? I want to suggest that from the analytics, the app analytics, it's good to look at the demography, the population of adults. I mean, the Inuka is reaching the population of youth to adolescents that Inuka is reaching, and that one will give us a view of how the reach is, and if maybe it's not appropriate for adults, or how can it be appropriate for adults, or maybe it's not appropriate for youth, how can it be more appropriate for youth? And what gap do you think we haven't covered? I think from the second bullet, we'll be able to know what gap. If we also ask the consumer of Inuka, what do you think we can improve on? How is Inuka meeting your need? So it will give us more idea on what gap. I think for now, this is what I have. Thank you.
Great. Thank you so much for that insight. We have been taking notes. So we are continuously working to improve our product and make sure that we can offer the best service to everyone. And what you've shared with us is key insights. Thank you for that. I don't know if we have another.
Back to Jessica's question, because she wrote it also. Do you have data on postpartum depression, and what are the trends in trying to solve the problem? Is there a decrease in, let's say, the last 10 years? So maybe the first part of this question. So we do have data on postpartum depression, but it is not significant data in the sense that when we review transcripts, and by we, I mean our supervisors, who obviously have to review every transcript. So you can imagine they read the transcripts, they look at, as I mentioned, thematic issues. So we're able to pinpoint and say, you know, postpartum depression is perhaps within this particular community high, or the topic keeps coming up, right? And then we may work with certain mothers through screening, through our problem-solving therapy to address the issue. Now, when it comes to macro data or any kind of specific trends, we haven't got data on that. And obviously, because Inuka is not specifically looking at data on key thematic issues for now. I mean, we are doing a lot more partnerships, as we mentioned, for example, in South Africa with a research institute that is looking specifically at HIV/AIDS and LGBTQ. So Inuka is the tool that is allowing them to see if at all it helps in solving the problem of low medication adherence or not. But for postpartum, we don't have enough data to say in 10 years or not, as we've only even been operational really product from 2019, right? So I hope that answers your question, Priska. Great.
Yes, it does.
Okay. Sorry, do we have any more questions for now? Thank you all for your feedback, the ones in the chat. Please do use it. You are, quite a number of you, and I'm sure you are all working or starting to work on your innovations and figure out your own specific segments, that target audience that you want to work with. So please do share questions that you have, etc. Maybe you can let us know if you put your hand up or not, or in the chat. And again, also it's to share on these discussion points, right? You may not have a specific question, but we're always keen to get feedback, as Yinka has shared, on how can we improve upon our insights. And definitely, one of our key goals, Yinka, a bit like Friendship Bench has done, is really having ourselves as, primary point or front line when it comes to mental health. Of course, a lot of it does involve working with policymakers, with public, with government and other institutions to make this possible, right? We need to also have the buy-in and the willingness of these institutions in order to also make that more easily accessible. Great. Charlene?
Great. Thank you everyone for participating. After our discussion, we were actually going to go into our next steps. So Ankiza, maybe you could just take over in relation to our next steps, and then we can close off.
So for us, we really do set ambitious goals. It's been a long journey, and I think as we have taken you through this presentation, it's really important to note that this has taken almost half a decade of our lives, right? Over 5 years of our lives have been dedicated to this. Innovation doesn't happen overnight. It is a long and tiring process. And we're happy that we are still standing here today before you. But it's really important that to get to this point, there have been a lot of tears and a lot of sweat and a lot of failure that has gone on to it. So what are our next steps? And those are just key things I'd like you all to take away. I think we think of innovation and we think about, very quick adoption curves and very quick research coming out. And in the African context, this is very, very far from the truth. It takes a long time, to make change, and especially to get everybody on the same page is very tiring work. So while you are researchers or data analysts, You will also become experts in lobbying. You will also become experts in whatever community you're serving. I'm not a healthcare worker, but I learned a lot about healthcare. You will become experts in all types of field along the way. And this will definitely enrichen you as a person. So our next steps is to further strengthen proof of effectiveness in different contexts. One of the key roadblocks we get as an NGO or a nonprofit, even as a social enterprise, is, the key question is, is there enough research suggesting that mobile interventions are effective in mental health, right? So we are conducting different research in different scenarios, and I mentioned some of those in our projects, to really validate that this can be used in a humanitarian setting, in a rural setting, in a classroom setting, etc. Then we want to strengthen our solution. Technology is not stagnant. We are currently now integrating AI into it. It's very key, very important for us to make sure that we are ahead of the curve there. So really very practical steps. We can do better machine learning that way. We're also able to help our coaches and supervisors when it comes to reviewing transcripts and other areas that we are exploring right now. We also hope to impact over 1 million at-risk people by 2025. So again, this is very much in our implementation projects and all the work we're doing on the ground to make this happen across Africa. So yeah, these are our next steps. Charlene, next slide. So thank you all. As we close out today, I want to hand over to Charlene to close out. But on behalf also of myself, Charlene, the APHRC team, and all of you that have really stayed with us for all this time, we really want to appreciate you and to encourage you on your own journeys of innovation. Let's remember, nothing comes overnight, or they say for every overnight success was 10 years of hard work. So we will put in the work, and we also are excited to see you guys as the next innovators. Innovation is not necessarily always about recreating the wheel, but it's about taking what is there, what existing data is there, and making the most of it or building upon it. And that's what we need more than ever now in Africa. So thank you.
Great. Thank you so much, Ankiza. Thank you all. A good afternoon to all of you once again. We have come to the end of our segment. We hope that you were able to learn from Inuka Africa, from our innovations and everything that we have had to build just to be able to get a product to market. At this particular point, I'd like to hand this back over to Joel and team so that you can officially close us off. Thank you so much for being such an engaging audience. We loved hearing from you, getting to know you a bit more as we went through today's segment. Joel?
Thank you very much, Charlene and Ankiza. I think this was quite